critically analyzing national affairs. This is State of the Nation on today's News Talk Radio, TNT.
Are you hip to functional medicine? I've been learning a lot about it. We've got the man to talk about it here with us today. I've been learning about it for a while here, and I've noticed that finding a doctor who's willing to talk about human health and happiness as it pertains to diet and other things that you and I do have control over is rare in this day and age. And it's almost always a pill, a shot, or a cream for a symptom, and never a search for the root cause of the symptom. So our next guest joining us is the cardiologist for people who don't want to go to the doctor. And he calls himself a preventional cardiologist. So joining us now to discuss is the founder of Well12 Health, Dr. Sanjay Bhojraj. Dr. B,
hey,
welcome
perfect.
to State of the Nation. First off, give us a little bit of background on yourself and how you came to be here.
Sure. Well, Brian and Steve, thank you so much for having me. And I think it is an important conversation that we're going to have today. So by training, I am an interventional cardiologist. So I was kind of the person you never wanted to see at 2 a.m. That meant that you're having a heart attack. I would drive in lights and sirens into the hospital, open up your artery. Everyone was happy. We'd high five and chest bump. And I did that for about 15 or 20 years until I realized, why does this keep happening, right? You watch Shark Tank or one of these business type shows, and they always talk about the repeat business. Well, I feel like in my universe, you shouldn't have repeat business, right? This should be a never business or a one and done. And that led me on this path to figure out, what are the 10,000 steps that happen before a heart attack, and what can we do to intervene before something happens? So you've heard of rehab, right? Like you tear a rotator cuff, and you have to go to physical therapy. We're talking about prehab here. So what can we do before, right, to condition your heart, to condition your body? And as you mentioned, it is really a conversation that most doctors aren't comfortable having, because in the conventional medicine space, we are a pill for every ill. We are a surgery. Let's cut this out. Nobody really talks about health in our space of conventional medicine. We kind of focus more on how to not have you die, right? And as you know, from any sports game that you watch, there's a difference between playing to win and playing not to lose.
Yeah. Dr. B, thanks for joining us. I just, we can't ignore the elephant in the room, and that is vaccine illness, vaccine injury. We're seeing a lot of died suddenly cases. Typically, the people that are dropping dead are young, otherwise healthy individuals. And I know that for most part, when you're talking about prehab, which I love that idea, the concept of just staying healthy so you don't have to go to rehab somewhere down the road. But what do you say to people that have taken the jab? These guys or gals go to the gym every day. They eat right. They watch their carbs. They do all that stuff. Some are on keto diets. Some are on paleo diets, whatever. And then all of a sudden they're out walking around the neighborhood and they drop dead of a heart attack. And we find out they had every jab and every booster you could have. What's your take about all that?
Yeah, well, it's a tough call, right? And I think it's very personal for everyone. I can tell you that during that time of COVID, I was in the trenches. I was in the intensive care units. I was, gloving head to toe, personal protective equipment, all that stuff. Every time I got home, I didn't touch my kids. I just ran upstairs to the shower and showered every day. And there was one day where I took 12 showers. I felt like my skin was going to fall off, like that scene in Poltergeist, if you remember, where he shaves and all the skin falls off into the thing. Like, that's how I felt. So, I think that in a time of disaster and trying to figure things out, you do the best you can, right? And it was a personal decision. So for me, I got every booster, and I was kind of joking, if I had to get in my eyeball, seeing what I saw, and that was the only way the vaccine worked, I would have gotten it. Now, we're out of that crisis mode, and these stories are adding up, and I don't think you can deny them. Certainly it's happening, and I think that one thing that I will say that COVID taught us, though, is the ownership that we have over our own health, and how we really have to take control and maybe not trust institutions, not trust other people, but take it on ourselves. And you mentioned my Well12 program. That's exactly what I'm trying to do here, right? I'm not saying medicines are evil. I'm not saying you never need surgery. And in fact, if you're having a heart attack, get to a hospital. Don't try one of my deep breathing exercises, right? But it's time to take ownership. Let's get our diets in order. Let's get our stress in order. Let's get our sleep in order. I don't know if you guys have read the Arnold book, Schwarzenegger's book that just came out. If you have it, fascinating. And it's even better in audiobook. But one of the things he says in there is you can't cheat the reps, right? Like if you want the outcome, you have to do the reps yourself. And similarly, when it comes to getting your health, you can't pay somebody else to do it for you, right? I can't pay you to get healthy for me. I have to want it to do it on my own, and I have to make the changes that get me there. And Well12, my program, is exactly that. It's the scaffold, it's the structure to get you to where you want to be.
Yeah, and I was looking at the website earlier. It's really cool, so I do recommend that you get out there and check it out. Now, Dr. B, next month is Women's Heart Health Month, and we have a PSA that rolls here during some of the intermissions between shows about this topic. So, I can't think of a better person to ask, seeing as I'm sitting here with you right now. What can you say for women? A lot of people think that heart attack is something that only happens to men, and we could get into the numbers and excess mortality and all that stuff that's changed since 2021. But we'll put that aside for the minute and just sort of like tell us what you think about like if you're a woman and you're having random chest pains or something like that. What do you say to that person?
Well, it's not even chest pains. It's anything. So, number one, the first thing to realize is heart disease, heart attack, kills more women per year than breast cancer and all the other cancers combined. It's just not something that people are going to get excited to wear a ribbon and go walking in, but it's a big deal in women. And furthermore, the symptoms that women experience aren't that classic mentioned chest pain, but it's not always that classic elephant on my chest, cold sweat, leaning over, because it only took medicine about 50 years to figure this out, but women are actually different than men, right? So how do they approach? So it tends not to be those lights and sirens type symptoms, but it's shortness of breath, it's fatigue, it's just something doesn't feel right. In fact, one of my first patients after I finished my training and became a real doctor was a woman who had gone to a different hospital than mine, complaining of, I just didn't feel right. And they said, you know what? Probably not a big deal. We did this, they checked some cursory blood work. Then they actually told her, just go home and have a glass of wine. It's probably some anxiety. That woman knew something wasn't right, had her husband drive her to my hospital. And would you believe the second she crossed the threshold of our emergency room, she had a cardiac arrest. So we were able to get in there, opened her up, fixed her. She did great. She's a fabulous lady. I still, see her in clinic. But unfortunately, because it wasn't that classic elephant on my chest, there's a bias even in medicine against women sometimes. So, I would tell women, trust yourselves. You know yourself better than any doctor does. And if something doesn't feel right, don't give up, right? Don't get gaslighted to think, oh, it probably is just stress or something or anxiety. I will have a glass of wine and see what happens. Get checked out. Make sure that you're comfortable with the workup, with the evaluation that you're having. And that goes for guys too, but I think especially more for women.
Yeah. And the problem with that, of course, is a lot of women probably unknowingly think, well, this is a guy thing, and they don't take it as seriously as they probably should. Let me ask you this, doctor, and I tend to ask this to every doctor that's been on since basically COVID. And I still think it's a pertinent question. Part of the problem that I see that happened with COVID, beyond the obvious, beyond the people dying, beyond the losses and all of that, the biggest loss in a lot of ways was the loss of trust within people and the medical profession. I don't know if that could be the CDC, could be National Institutes of Health, but that trust has been burned. I think a lot of us would lay the blame at the feet of Dr. Anthony Fauci, but that's neither here nor there. My question is, as a doctor, do you notice that, and how do you get that trust back? Because Well12 sounds like a wonderful program. This is preventative medicine. I trust preventative medicine is what I'm saying. So, but how do you get that trust back in the medical profession?
Yeah, well, trust is a big deal, right? And I think when you look at all the different professions, the trust, that bond that you have between doctor and patient is one of the most sacred things there is, right? So, number one doctor isn't every doctor, right? And your doctor is not, unless you happen to have him as your doctor, is not Dr. Fauci, right? So, I think number one, just realize doctors are human and we're always trying to do the best we can, right? Like we're not like waxing our curly handlebar mustaches and trying to figure out how we can kind of put one over on patients. We are trying the best that we can do. I think though, kind of a little bit of a way to reframe that question is, what I like about this is not necessarily the lack of trust of physicians, because like I said, that's important. But I think the emphasis on self-reliance, right, is taking over. I think that is a big deal. And that was one of the unintended consequences of COVID. Now, as a medical community, I think that we need to be open, right? And say, you know what, in times of war, you do what you need to do. And we had no idea which way COVID was going to, was it going to turn left? Was it going to turn right? Was this going to be an extinction level event? Or was this just going to be like a common cold, right? And we were trying to figure this out as we go. And there was no precedent in modern times how to respond. It's not like there was a textbook in the library that I could refer to. Oh yeah, just do this, that, and the other, right? So we tried the best we could. But, again, I think just getting back to this idea of relying on yourself, I think that's a big deal, that personal ownership. And that's, I think, one of the great benefits that come from COVID is that people are now realizing that not necessarily I can't trust my doctor, but I know what I can do for myself, right? Yeah. And I think, Steve, you mentioned paleo and carnivore and kind of all these other diets. Realize that this is not a one-size-fits-all type situation, right? There's a little bit of give and take. There's a little bit to figure out, right? I don't know what kind of car you drive. I don't know what kind of car you drive, Brian or Steve, but the car that I drive might not necessarily be the right one for you because we have different needs of a car, right? So similarly, our genetics are different. Our exposures, like I grew up next to Gary, Indiana. So I remember, you've got the northern lights. Well, we had the pink of the steel mills, like lighting up the night sky. So I probably had a ton of heavy metal exposure growing up that, that my body has that yours might not, right? So we have to honor our individual differences, not just in genetics, but the things that we're exposed to, and kind of work with our bodies as opposed to against our bodies. And that's all kind of baked into that Well12 program that we talked about.
Yeah, it looks really, really great. Again, well12.health. That's 12, WELL 12.health. Head on over there. It's a great site. There's a free morning routine that you can check out over there. And then there's your reset program, which is based in functional medicine, and it includes diet optimization, daily food log reviews, and a community. That's something I've found helpful in situations like this before too, is having a community of users that one can interact with. I mean, in our last couple minutes, talk to us a little bit about functional medicine and how that could be important across different, searches for doctors and for help, right. Whether it's dental or for your pet or, whatever.
Yeah. So the idea of functional medicine seems cutting edge, but it's actually, I think, one of the most primitive types of medicine there is really using your body to heal itself, right? I think, Brian, you'd mentioned root cause. All these medicines that we have, right? They're treating a symptom. My blood pressure is high. I'm going to give something to give it low, but I'm not necessarily dealing with the underlying reason as to why my blood pressure is high. I have acid reflux. I'll give you a medicine to suppress your acid, but why is your stomach churning and refluxing in the first place? By the way, spoiler alert, make sure to chew your food 33 times and your reflux might get a lot better. But the idea behind functional medicine is really using the body to balance itself. So let's get away from medicines, right? Let's get away from surgeries and all of these things. Let's use our nature, right, to heal ourselves. So that's really the idea behind functional medicine.
Well, it's really interesting. And I tell you, I go to my doctor sometimes, and she says something that I love her for. She says, Steve, it comes down to common sense. Do you have any? when I asked her about, I got to lose some weight, and she goes, it comes down to common sense. But preventative medicine and Well12, this is a program that kind of puts you on the path of getting in touch with your own body, I guess, correct?
That's exactly right. So there's a fighter jet going by down here next to Fighter Town in La Jolla.
Oh, I got you. Well, listen, Doctor, I want to thank you for joining us today. We hope we can get you back on and talk more because this has been a real eye-opener. I'm going to your page as soon as we hang up. Well12, that's well12.health. Dr. Sanjay Bhojraj, Dr. B to us. Thank you for joining us on State of the Nation today. Have a wonderful day, and hopefully we can get you back here, I don't know, real soon.
It's been so great, and stay warm and stay safe, guys.
Thank you so much, Doctor. Take care of yourself.